Well, ladies and gentlemen, that's the result. Yeah! And you know, it's amazing stuff. The treatment I got, interleukin, is an immune system substance that normally exists in tiny amounts in your blood. And they biomanufacture, I know I'm using the wrong words, quart bags of the stuff and drip it into you through a central line 3 times a day. The side effects nearly kill you, and yet that first yellow line was the first round of treatment. The red starburst is where my leg broke. The second line of, notice how it dropped like crazy in the 2 months between the 2 rounds of treatment. Amazing stuff. Now, medicine, miraculous. Health IT, not so much. Okay, I've been astounded. The things I heard at the FDA yesterday, the things I've been learning about how backwards much of the health IT industry is. When you find yourself in a hospital, involved with it in a hospital, all I can say is there are a lot of hardworking, good people there, and the records may be wrong, may have mistakes in them. Get engaged, look at them. Here's what I found. Back in April, as I know a number of you are well aware, my hospital had advertised, we're now connected to Google Health. Click this button and we'll move your data into Google Health for you. By the way, I am a marketing analytics guy in my day job, so I was completely grooving and tweeting on what you were talking about. I get off on this stuff. I really do. That's why they call us geeks, right? So anyway, so I punched the button, Google Health, and what came across was a false medication warning. It said your low potassium conflicts with your blood pressure medication. Well, that's great, except the low potassium was 2 years earlier when I was in the hospital. Not current. So then I started thinking, part of what I do, in addition to the web analytics, I do data for our marketing system at work. So if the zip code shows up where the phone number is supposed to be, I know how to hunt that down. So I started looking at what went wrong with this data transfer. And then I realized that they transmitted every condition I had ever had with no date attached as if it were current. And I thought, well, this is stupid. But these are smart people, and they announced that it was a working interface, so what the heck is going on? This is also an issue of responsibility in social media, because one possible reaction to this is to go out and flame and say, ha ha, this sucks, blah, 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 blah. But what I'm about here, frankly, once I found out that I was going to survive, I asked myself, what am I going to do with this free replay in the game of life? Because it really was like being at the end of a video game and then discovering, go out and play. So ranting is not very inspiring, but if I can help build a new world, that would be cool. That would be a useful thing to do second time around. So I talked to some people, and what we eventually figured out, the hospital, by the way, was totally not helpful. It was like, well, look, 5,000 other people have done it, and they haven't complained. So this must not have happened. That's basically what they said. But what we figured out was that the hospital had transmitted billing data instead of my clinical data. Why? Because the billing data already existed in computerized form and was convenient. Now the fact that it was crap and erroneous and everything didn't influence them. There are all kinds of things in here that never happened to me. Now in some cases, we know it was upcoding, which is the thing like my supermarket. They have bologna in the deli case, and then right next to it they have something that looks very similar that's labeled Tasty Delicious Bologna that sells for 20 cents a pound more. And so, for instance, one of my radiology reports said aortic aneurysm. Well, no, excuse me. The radiology report said the base of my aorta was enlarged 1/4 inch. Well, for that visit, you can bill the insurance company more if it's diagnosed as an aneurysm, and the slightly enlarged base of the aorta qualifies as that. Apparently, this happens all the time. I'm not going to get into the politics of the billing business, but it's useless as a proxy for clinical reality, right? Not only that, but if that gets fed into the MIB, the Medical Information Bank, which is the insurance industry data bank, that can show up as a condition you never had that can cause you to get excluded from other kinds of coverage. This is nasty. It's bad IT practices. In fact, the most accurate blog post about this whole adventure was written by IQ Trainwrecks, which is an information quality Trainwrecks blog. They understood how poorly used data can lead to wrong circumstances. Anyway, how good is your PHR, your hospital's data about you? Here's my most recent episode. In September, I had 2 specialist visits. I had 4 conditions, 2 treatments were received. Here's what shows up on my hospital's website for me. That's it. The fact that I had 2 outpatient visits doesn't even say what kind of doctor. And just, it says actinic keratosis, which is a precancerous thing that was taken off my forehead. And that's all. Now, in the back, the doctors have the real data. But in terms of me, if I wanted to take this and go to a different doctor or whatever, take my records with me, no can do, baby. That is disempowering, and I don't like that very much. So, here's the thing. I want my mashups, right? I want to be able to take my data, give them to crazy innovators who are going to go out and do amazing things like these people have been talking about. Develop new intelligence, new knowledge, new ways to empower me to be engaged in my health. Why shouldn't innovation happen with health data as fast as it does with iPhones, right? Then, as I was preparing this talk, part of this talk in September for a conference in Toronto, I ran across this website, visiblebody.com, which is like the Plastic Visible Man website, except instead of removing plastic layers, you can just click on things in the menu on the left and remove them. There's my psoas muscle, son of a gun, that the cancer was attached to. I'd never seen what it looked like before. So I just clicked and removed things until I could see it, and then you can like rotate that in 3D, and it's like, wow. And that night I had this epiphany. Remember those digital CAT scans before? Why not mash that up with this thing and have Google Earth for my body? Right? Why not be able to look at that? And so my doctor actually has a plastic model of a heart on his desk, so he can say, well, there's the gazintu that goes around and all this stuff. Why not be able to say, look what's happening to your heart because you're not exercising, right? Be able to see my stuff. Or as I start, now sure, I'm talking about 5 or 10 years down the road here, but why not, right? Well, and the answer is because the quantified patient is in prison. That data is locked up in the hospitals, not getting out. And what that means is innovators can't get at it to add value. That's what innovators do. To me, it comes down to, this was a great TED talk earlier last year, raw data now. Tim Berners-Lee, the father of the internet, said that the next wave of what's going to happen on the web, first we get Web 1.0, which was just the read-only web encyclopedia publication sort of data. Then there was Web 2.0, which is read-write. He said the next big thing is going to be smart agents that will go out and look at raw data and develop new knowledge. Not go find other people's interpretations, but develop new knowledge. And by the end of this talk, he said, you can't do that by looking at other people's articles about the data. You got to get at the raw data. By the end of this talk on TED.com, you had people chanting raw data now. We have a Society for Participatory Medicine. Those of you who are doing this work, we are really open for exploratory articles as well as more rigorous research. I want to wrap up with 2.8 years in pictures. First picture here is from the day after my physical 3 years ago. That was a guy who was dying of cancer and didn't know it. Okay, that was New Year's Eve, 2006. Then 10 months later at the office Halloween party, I thought that was a kind of appropriate picture. A little bit on the lean side, but grinning at the ghoul. That was at my mother's wedding. Excuse me, no, that was not my mother's wedding. That's my daughter's wedding, right, last May. This was a wonderful thing to be alive for. And then finally in September, of all things, I actually wrote in a bike fundraiser because this summer something bizarre happened. I said, I want a bike, which is like really weird. It's sort of like saying, I want pickles and ice cream. Like, where did this come from? So that's the thing, ladies and gentlemen. That's an engaged patient. Free patients.